Hi. Welcome to my channel. This channel is dedicated to provide useful health and nutrition information. Food as your medicine. Honey. Honey is often referred to as the nectar of heavens, because of its rich golden color, velvety texture, and its irresistible sweetness. With increasing awareness amongst people about the harmful effects of sugar, honey is increasingly being used as a natural sweetener all over the world, replacing the use of our household white sugar altogether. What makes every single drop of honey so precious is the way in which it is made by extracting the nectar from the flowers, after which it is stored in the upper aerodigestive tract of a honey bee and then concentrated in a beehive by a dehydration process. The composition of honey. Honey is a complex liquid containing more than 200 substances, which is what gives it a rich texture. The composition of honey depends on the flower from which the nectar was initially extracted, as different flowers have different substances in their nectar. The components which are found in all kinds of honey include certain flavonoids like quercetin and galangin, phenolic acids, certain enzymes like catalase, and superoxide dismutase, along with small quantities of reduced glutathione. However, the main components of honey are glucose and fructose, but some amounts of fructooligosaccharides are also found. Along with these, it also contains certain vitamins like vitamin C and vitamin B, including thiamine, riboflavin, and pantothenic acid, minerals like sodium, magnesium, calcium, and mainly potassium, and enzymes, most of which is extracted from the flower and gives honey its medicinal properties. The beneficial properties of honey. Honey has been used in the form of natural medicine for the treatment of various symptoms for centuries. Initially, it was used by Egyptians and Romans for the treatment of injuries and intestinal disorders. Research over the years proved it as a possible remedy for other conditions as well as liver, cardiovascular, and gastric disorders. Recently, its anti-inflammatory and antibacterial activity has also brought attention to its use as a natural remedy for multiple diseases. Honey for wound healing. Honey has a history of being used as a found dressing after an injury, to accelerate its healing of the wound as well as protecting the wounds from an infection while it heals. This has allowed it to be used by the Russians in World War I to treat their wounded. The property of honey that allows it to be used for this purpose is it cleanses the wounds due to its antimicrobial action, reduces inflammation, and induces tissue regeneration for accelerated healing. Honey can be used for all kinds of wounds, whether it is an abscess, abrasion, and even on an amputation. However, the application of honey may be different for all. The severity of the injury determines how thick a layer of honey must be applied to neutralize the wound exudates. In general, it should completely cover and extend beyond the wounded area, after which it should be covered by a dressing. Honey for GI tract diseases. Honey has been used as a natural remedy for gastrointestinal tract infection because of its protective effect on the intestinal tissues. This is because honey has been found to prevent the attachment of certain disease-causing bacteria like Salmonella Interiditis on the intestinal cell. Since attachment of the bacteria to a cell is the first step is the development of disease after arriving at the site, preventing this first step is the most effective way to prevent disease. An investigation showed that even a diluted form of honey up to 1/8 of its usual form was able to affect the bacterial cell attachment, bringing it down from 25.6 plus or minus 6.5 to 6.7 plus or minus 3.3 bacteria per epithelial cell. This proves just how potent treatment honey is for the prevention of gastrointestinal diseases. Honey as an anti-inflammatory agent. As discussed earlier, honey has a strong anti-inflammatory effect, and this has allowed it to be used on wounds to accelerate their healing. However, many other inflammatory conditions in the body require anti-inflammatory medication on a long-term basis. These medications, although effective at treating inflammation, have numerous unwanted effects like immunosuppression, inhibition of tissue growth, and even damage to the normal cells. Honey is a natural anti-inflammatory medication that does not have any side effects on the normal cells of the body and only shows its action on the site of inflammation. Honey as an antioxidant. Pure honey contains certain components like flavonoids such as apigenin, pinosembrin, camphorol, quercetin, galangin, piperacin, and hesperetin, phenolic acids, such as ellagic, caffeic, p-coumaric and ferulic acids, ascorbic acid, tocopherols, catalase, superoxide dismutase, reduced glutathione, Maillard reaction products, and peptides which exert a strong antioxidant effect on the body collectively. This antioxidant property of honey was tested on 30 grams of beef patties which were to be stored in the refrigerator for 12 days or frozen for 45 days. After this time, when the patties were taken out and tested for the presence of oxidative substances like thiobarbituric acid-reactive substances (TBARs) and lipid hydroperoxides, it was found that those containing honey had lower quantities of these oxidants as compared to ones without it. This may allow the honey to be used as an alternative to preservatives like sodium tripolyphosphate to delay lipid oxidation. Honey is one of the most important natural products in the world today and is a source of numerous natural medications. Although it is considered very safe, due to its high sugar content, it must be used with caution in diabetic patients as well as infants. Here ends this video. If you found this video useful, enjoyable or educational, please like, share, and subscribe to receive other videos like this one in the future. Thanks for watching. We try our best to provide you with accurate health and nutrition information. If you have any specific health care needs or concerns, please see your MD or other health care provider for specific guidance, diagnosis, and medical advice. Goodbye.